Once you make an appointment with our office, a consultation appointment, you will meet the doctor at that appointment. He will discuss what you can expect, what he needs you to do preoperatively to prepare for the procedure.
During that consultation appointment, we of course are doing the clinical examination and obtaining records, photographs, and x-rays. But during that time, we also are spending time utilizing anatomic models, illustrations, videos, and textbooks to try and explain your current clinical state as well as the treatment options that you have in front of you.
You know, when we see a patient for the first time, we have to understand that they are coming to us with a problem, with a need, sometimes with fear and anxiety, and we really have to put ourselves into their shoes and understand their stress level and anxiety towards us and our profession.
I find that one of my biggest challenges in treating somebody is, number one, trying to break the ice, trying to make them understand that I'm a regular person. I'm not some doctor that's standing off somewhere that doesn't really care about them as an individual. And I try to make sure they understand that I'm here to help them. I'm here to do things for them.
We take great pride in the quality of care we provide to our patients. We understand that patients may be anxious or nervous when preparing for surgery. From the time they come in to the time they leave, we are with them throughout the process. It's important for our patients to know their dentist and doctors have referred them to our practice because they will receive the highest level of patient care.
When we get a chance to work with these patients from beginning to end, one of the best compliments we ever get about the work and about the treatment is when they tell us they don't have to think about their teeth anymore. That's some of the best compliments we can get. We can remove years, sometimes decades of concern over failing dental work, failing teeth.
One thing I'm proud of with our practice is all our surgeons care about the patient first. We do not want to have anybody go through a painful process when it can be avoided. And part of that is knowing what you're looking into, knowing what you're facing. And if you, the more you know, the better it is.
I like the patient contact. That's what I like the most about oral surgery and dentistry in general, is the ability to have direct one-to-one contact with patients. Patients who come to you because they need something done, they need some help, they're in pain, or a variety of other problems that they may have, and you have the opportunity to have a positive effect on their life.
Carolina's Center for Oral Surgery does a lot of fantastic things, of those which we do removal of wisdom teeth, we provide jaw surgery, we place dental implants, we do reconstructive surgery, we do jaw surgery, corrective jaw surgery, we do cancer surgery.
The majority of oral surgeons in the United States simply take out teeth and put in the occasional implant, but we strive to do more than that. We are competent in major facial surgeries, jaw reconstructions. We're trauma surgeons.
We're the only accredited oral surgery practice in the region, one of only 2 in the state, and what that says is we put a lot of emphasis on patient safety, patient care, and we do that by putting our resources, both our staff resources and our financial resources, into providing a facility where someone can come, their daughter, their son, their parent, or themselves, and they can know without a doubt that we have taken every precaution to make sure that their visit will be safe.
We all have the same compassion for patients. We all have the same desire to make our patients feel comfortable.
When we have patients that have had great results and we know that they've had an improvement of their condition and we've changed their life, it reminds us every day why we do what we do in our profession, and it keeps us coming back day in, day out.
When you have an opportunity to practice a specialty like we do, patients obviously are very apprehensive before they have anything done. They've heard stories before, they may have their own imaginations about what things are going to be like, and there's a lot of concern, and that's understandable. But when you start at that point and you can bring somebody all the way around to the completion of treatment and you find out what it can do to change their lives, and to know that you've sort of brought them through that entire process, there's really nothing better professionally that I can think of.
Rest assured that with Carolina Center for Oral and Facial Surgery, you've made the right choice. You're going to get the experience of a top trained surgeon who will take care of you like you're a member of their family.
Wisdom teeth removal is our most common procedure. We tend to do it on a daily basis, multiple times a day. We do this under general anesthesia.
Well, the reason to take out the wisdom teeth is there's not enough room in the mouth for all of the teeth to make it in the arch. Unfortunately, there's enough room for them to get partially exposed in the mouth. And when they get partially into the mouth, that access lets food, debris, things like that to get down around it. And that's when people can develop pain, infection, always, of course, at the most inopportune time.
The process is very easy. The surgery's done here in the office. We remove wisdom teeth every day. Most of the time it's done while you're sleeping, and the surgery you'll think takes about 8 or 10 seconds, but in truth it takes 20 to 25 minutes perhaps to remove all 4 wisdom teeth.
There may be situations when you have a younger patient that could benefit from allowing those teeth to develop a little bit more. They may get closer to the surface and be easier to remove with less trauma to them. It may be that even in a very young patient, they have so much severe crowding that they may have to have teeth removed just to allow other permanent teeth to come in and be in a functional position.
Reasons to have wisdom teeth out are for hygiene reasons. If sometimes the teeth are erupted partly in or fully into the oral cavity, it is difficult to get floss and a toothbrush back that far and get good cleaning.
Bacteria that are found in our mouth travel underneath the gums and essentially get stuck between the second molar and the wisdom tooth. Chronically, that's going to lead to inflammation, which causes pain and swelling. It also makes you at a much higher risk of developing cavities.
The problems that can arise associated with impacted wisdom teeth are really varied. They can be as simple as just minor pain and swelling of the tissue around the teeth. They can be as severe as neck infections that threaten a person's airway, and in some cases even cysts and tumors that form around the teeth in the jawbone.
When you are an adult and you have a wisdom tooth problem, we treat it the same way we do as when you're a teenager. You come in for a consultation, we'll look at the specific indications for the extraction, and there have to be even more defined indications for extraction as an adult. Some people beat the odds on a few teeth. A lot of times when teenagers come in for their wisdom teeth, they're all taken out because you don't know how it's going to progress in the future, and it's a one-time you're done. As an adult, sometimes it's only one wisdom tooth that needs to be extracted. So we don't have a one formula fits all. If it's one wisdom tooth that's causing pathology, as an adult, we'll take out the one wisdom tooth.
After wisdom teeth removal, there is a recovery. Everyone has a recovery. The normal person will be sore for a good 3 or 4 days, but sometimes it's shorter, sometimes it's longer, and it depends on each individual.
My son Payson needed to have all 4 of his wisdom teeth pulled. And we came and saw Dr. Nale, and he extracted all 4 the 1st of January. Our regular dentist had taken some x-rays and told us that it was about time to have Payson's wisdom teeth removed. One of them was coming in kind of sideways. I think the others, they all 4 were impacted, but the others were coming in fairly straight. And so he just recommended that we go and get all 4 wisdom teeth pulled. When we first scheduled the appointment, we'd scheduled a consultation time as well, and so we came in and Dr. Nale met with Payson and my husband and I, and kind of redid some x-rays of Payson's mouth so that he could really explain it to him, show him where his teeth were, how they were coming in, kind of went through what the procedure would be like, what kind of care was needed, the kind of before preparation, and not eating or drinking a certain number of hours before the surgery, and then talk to him a little bit about what would happen after it. I think you're always a little bit nervous about your children and how are they going to respond to a little bit of the anesthesia and just the procedure. And Payson actually is 19 and in school away. He's in college. And we had ended up waiting to have his extractions done right after the 1st of the year, January 2nd. He had to be back at school within a week. So we were a little bit hesitant about that. but we were reassured about any precautions we needed to take or if there were any situations that came up. So honestly, I felt very comfortable with what was going to happen today. I felt like the staff here had been phenomenal. Everybody we met, any contact we had with anybody from the day we came for our consultation and we were checking out to the morning of the procedure, getting patients checked in, everybody was warm and friendly, very welcoming, very polite. It was a very positive experience for our family. Payson did very, very well. He followed all the steps in his post-op, and he was very fortunate because he had very minimal swelling and no dry sockets or any of the things that can happen. But I would absolutely bring my other son back to this practice. They've done a wonderful job and just made us feel very, very comfortable.
My daughter Rachel went to a regular dental appointment, and through an x-ray there we discovered that she had an extra tooth that was preventing her permanent teeth from descending like they should.
I was very nervous coming to the dentist.
After we arrived at Dr. Crowley's office, we discussed also the possibility of needing additional extractions to make room for her permanent teeth.
I got to take my stuffed animals with me, and I got to bring them into the dentist so that would make me more comfortable.
One of the things that I liked the most about our first interaction was that when he entered the room, he introduced himself to me, but then he spent his time talking with Rachel, and I thought that was really important. She was ultimately the patient, and all of my questions were answered to my satisfaction, but the fact that he spent some time engaged with her, I think allowed Rachel to be more comfortable with what was coming.
He told me that it was going to be okay and that he was going to take good care of me.
I couldn't have been happier with our experience here for Rachel, and as a parent, I know that that's really important. So should I have friends that would be needing something done for their child, I would not make a higher recommendation than to come to this practice.
Dr. Crowley was really nice, and I want to thank him for doing that for me.
Jaw surgery is done when there is a misalignment of the teeth. So orthodontists can get the teeth nice and straight, but if they cannot do that, that is when we come into play. The jaws can be moved forward or backward, up or down, to make the teeth align better. And this is a true skeletal problem, meaning we move bones, we don't move teeth.
There's 3 different phases, and the first phase involves our orthodontist aligning the teeth. So they're going to focus on aligning the top teeth to the bone of the top jaw, and bottom teeth are going to get aligned to the bone of the bottom jaw. So when you do that, you essentially are going to make the bite look worse before it looks better. Then once that occurs, then we move to phase 2, which is us as the jaw surgeons. And so we are going to reposition whatever jaw requires repositioning, whether it's just the top, just the bottom, or maybe both jaws at the same time. But ultimately it's our responsibility to improve the skeletal discrepancy, essentially putting the top teeth above the bottom teeth. Once we get you through that month, and we give ourselves a month, then we get you back to the orthodontist for phase 3, and that is working on now aligning the top teeth to the bottom teeth.
Jaw surgery is done here in the office, and it's done while you're sleeping. And it's the same as having it done in the hospital, which we do as well. But we can predict and do it very quickly here in our office and have a normal recovery.
A visit to the orthodontist means changing a wire or 2, and ultimately you're able to be back to school the next day after they change the wire. You are not able to go back to school after we've done jaw surgery for you, and so certainly we need to make sure that we have a window in the calendar that allows the opportunity for recovery.
So patients come in and we see them for consultation for a jaw surgery. We will follow them through the entire process, which would usually take in essence of 6 months to 2 years to prepare you for jaw surgery. The jaw surgery itself lasts usually an hour, but the recovery can be as long as 2 weeks, and the total length of time for jaw surgery to heal would be about 6 weeks, and then you would head back to the orthodontist where they would complete the final treatment, and then you'd be done.
The procedure I come in for was to correct sleep apnea through jaw surgery. And the success rate for this type of procedure was 94%. Well, I had sleep problems for years, and I've tried sleeping pills that worked for a couple of nights, and had a sleep study done, and they fitted me with a CPAP machine that worked for a while, and got where I was choking in the mask, and went back with another sleep study, and they put me on a BiPAP machine. Again, after a while I started choking and got to a point where the only way I could get sleep was to lay on my stomach. And that really worked against another condition I have, which is chronic back pain. So what I've got here is a very complicated situation of sleep apnea and chronic back pain. It was a necessity for me to do this, and there's been a lot more nice surprises and no negative surprises because I was well informed. Just not having to use a CPAP machine or BiPAP machine makes a world of difference. The membrane in my nose was trimmed and my sinuses cleaned out, and now it feels like I'm breathing the world, and it's never been that way for me. And it is a life-changing event for me, and I'm so thankful I come here.
My daughter, Mary Stewart, she had a significant overbite that was not being corrected with her orthodontic procedures, braces, the works. It was continuing to be there. So we decided that a possibility to help correct this overbite would be to have her jaw operated on. We knew this was possibly cosmetic, but we were hearing from our orthodontist that she would continue to have problems with her teeth had she not had this surgery. He was wonderful. He explained the procedure, what was going on. The thing I liked the most about Dr. Farrell was that he spoke to Mary Stewart. He knew that she was the one that was the patient. Even though at the time we were all in there, she was only 12 years old. He said, "You're number one. It's your questions, it's your procedure." And that kind of led us to realizing this is her decision too. And so we all were involved as a family. That meant so much to us.
I was nervous when I came to talk because I didn't want to get surgery. But once I started talking to the doctor and everything, he answered every question I had, and he spoke directly to me, which I appreciated, and not just to my parents. And he answered any questions that they might have had too, and I felt a lot more confident after the meeting.
The thing I appreciated the most was everything was told to us ahead of time, what to expect, the good and the bad. That is really important for a parent and a child to know this is what is going to happen, this is normal. You're going to have a horrible sore throat. That's what they kept telling her. The worst part of this whole thing is just from the intubation. Your throat is going to hurt. Well, we all appreciated that. We appreciated knowing what to expect and that it was not abnormal.
The staff and the doctors treated me great. They're really nice. They asked if I needed anything, constantly made sure I was taken care of. I wasn't feeling nervous or scared. One of them was always by my side during the entire time, whether it was a nurse or the doctor, just someone at the hospital helping out.
The main point I would like to say is that they know what they're doing. They've done it so much they could do it in their sleep, but they know it's a first time for us, and that's what matters. We know what to expect because they told us what to expect.
The benefits outweigh everything. So I can notice a big change in my life, how I eat, how I look in different photos now. I feel great about my appearance now because of it.
I had braces in my mid-30s. Probably 3 years after that, I developed temporal mandibular joint dysfunction problems. And This caused some pain. I was put in a night guard. That helped immensely, and it was only in the last couple of years prior to my surgery that the level of pain really stepped up. And you could hear me chewing from over there. It was exactly bone on bone. And it was not getting any better. Nothing I could do that would improve it. And so that's what brought me to Dr. Nale. From a scale of 1 to 10, 10 being the worst pain, I was averaging 7 pain, pretty much 24/7. I was referred to Dr. Nale from my orthodontist and my dentist for jaw surgery. When I came in, I was immediately impressed by the staff, by Dr. Nale, and the thoroughness that he took the time to be as thorough as he did. I had the jaw surgery, it was a success, and I'm out of pain. What more could you ask? The recovery time was between 4 and 6 weeks to totally feel back to normal. Of course, the jaw was very stiff after the surgery, as I knew it would be. The shock of what I considered to be major surgery was huge for me, but everything worked out. It was totally what he said. No surprises. I am very happy with the results. No more pain, and I can eat anything I want.
Typically, a patient will have met with their dentist or prosthodontist, had the treatment plan formed, and have had a consultation in our office regarding the implant placement. Once those things are decided upon, the patient comes back to us in the office. We place the implant or implants, usually in a very quick appointment, many times even just under local anesthesia. And the patient is back out the door and in many cases back to work either that day or the following day.
There are a variety of reasons folks need implants. A common problem is someone will break a tooth, and a broken tooth in some circumstances cannot be saved. So we take the tooth out, let the extraction site heal, or sometimes place the implant in immediately to replace the lost chewing surface.
There's a lot of things that, that implants offer, especially nowadays when the technology is such that you can really do very predictable work on patients that are probably more predictable than a lot of conventional dentistry.
We have computer software that is able to position implants in the exact ideal location. It takes all the guesswork out of surgery.
When you're talking about new imaging techniques that we have available to be able to not only make a diagnosis and determine bone volume and where vital structures such as the sinus and the nerve are, but also to be able to demonstrate to the patient in a way that they can understand it, because they can actually see their bone, they can see their teeth, they can see what their skeleton looks like, and it's just really a way to get them engaged and really participate in the treatment planning of these cases.
Some people have the false impression that implant surgery is just horrible, painful surgery. It's generally easier than an extraction. The recovery is generally easier.
The recovery time for dental implants with our technology these days is very, very minor. Most patients would compare this to having minor dental work, maybe a single tooth extracted. The need for prescription pain medication many times is not even necessary. It's much easier than most patients recognize.
In my late 20s, I started with periodontal disease. Devastating. I was brushed my teeth, I was a flosser, but it was genetics, a lot of different things. I lost many of my back teeth. Then I had to have bridge work because I lost one of my front upper teeth. Had bridge work, and within 2 years after that, I started getting decay underneath the bridge work, and it broke off. When I saw my dentist, this was in probably July of '09, he gave me the options of that I was going to lose all my teeth and have to wear dentures, or I could go and talk with a physician about implant surgery. When I went for my consult with Dr. Misiek, and he told me that I was a candidate and a very good candidate. for dental implant surgery. He said with what he called is the fixed hybrid. And I was thrilled. I was so excited, and that I knew that I could put my trust in Dr. Misiek and his staff to do just that, and they did. The staff, everyone from the girl in the front office to the business people to the assistants that the physicians have, are wonderful. They really care. They call you by your first name. They want to get to know you. Anytime I had a problem or a concern, I called and I was put right through, and they would say, "We'll see you today." Never put me off. I can eat anything I want. I feel good. My skin looks good. You know, and it has taken years off my life. And I mean, I'm healthier for it. I look younger. I feel younger because I use the opportunity as often as I can, whether it be at church or with friends, to share my experience. And if you feel you have no options, there are lots of options, and just know that there is hope